Welcome to Monday's edition of COVID-19. Starting today, social restrictions at levels 4 and 3 are in place for 4 weeks nationwide. Now, we have more on these measures later on in the program, and also a look at the situation over in Israel, where people are learning to live with COVID-19. Here first is the broader pandemic coverage with our Kwanzaa. Now, so let's begin with the latest here in the country.
All right, Sunny, for the first time in 5 weeks, we're seeing a Monday figure at below 1,500, below 1,400, that is, even with 1,375 infections tallied as of 12 a.m. And that is a drop in both domestic and imported cases from the day before. And if we take a closer look, that's more than 100 fewer cases than the day before. And again, if we compare the figure of Monday in recent weeks, this number does represent a decline from the previous weeks. And with that, Korea has a total number of 261,778 infections, and 2,327 people have lost their lives so far due to COVID-19. Onto our map, the capital Seoul and Gyeonggi-do province are seeing 400 or more cases, but it is a good thing to see a couple of regions here that are seeing single-digit figures of infections this Monday. Now, beginning this Monday, more students have started to attend in-person classes in the capital region despite being under the toughest level 4 social distancing measures. That meaning 2/3 of the student body at middle schools and half or all students at high schools. Meanwhile, high school seniors and first and second graders at elementary schools can attend every day. And a 1-month extension in social distancing measures has also kicked off this Monday, which means level 4 here in the metropolitan region as well as Jeju-do Island, with the rest of the nation being under level 3 with a few exceptions. And also the city of Busan has downgraded its level beginning this Monday a notch to level 3 social distancing measures. Despite the longer than usual extension, a few relaxations take effect, and that includes restaurants and coffee shops can open until 10 p.m. from the earlier 9 p.m. And there will also be incentives for private gatherings regarding people that are fully vaccinated. And officials here are saying that this 1-month span is very important.
We decided on these measures based on a comprehensive review of our current virus management, expectations of increased vaccination, as well as the upcoming Chuseok holidays. If we can stabilize the outbreak in the next 4 weeks, it would allow for an adjustment of social distancing measures in October to make them better fit into our daily lives.
And with that, the official is hinting towards living with a COVID-19 strategy, and that when the majority of the population has received at least 1 shot of COVID-19 vaccination or is fully vaccinated. Now, over the weekend, we have surpassed this 30 million milestone of people who have received at least 1 dose.
Right. Meanwhile, so what's the latest on the booster shot campaign in some parts of the world?
Well, Sunny, while Korea is preparing for booster shots, preparing that is for booster shots in the 4th quarter of this year, Singapore, which currently boasts the highest vaccination rate around the world, has announced to administer booster shots for weak and elderly people within this month. And Denmark will also start its booster campaign for nursing homes beginning this week. In Israel, a top COVID-19 advisor says that preparations for not a 3rd, but even a 4th shot should be made, while the U.S., which is planning to start its booster shot campaign in the next 2 weeks, there only Pfizer may be used for the time being, as other vaccines like Moderna need more time for authorization. If we take a look at the numbers now abroad, the U.S. is dealing with some of the highest hospitalization figures and deaths in recent months, and also the U.K. is seeing over 30,000 to 40,000 infections on a daily basis, while Russia has hit the 7 million milestone in the past 24 hours. And the total number of infections around the globe stands at 221.5 million. Those are the updates I have for now. I'll see you back after the government briefing. Sunny?
All right, so thank you as always. Right, back on the local front, a notable number of city dwellers are reportedly in favour of adopting rural life over urban settings, and observers believe the pandemic has played a part in this growing preference. To take a look.
Today, we visited a sleepy village down in central Korea to meet a married farming couple who recently moved here.
저는 귀농 8개월 차 박효근.
김미경입니다.
Park Hyo-gun used to be an office worker in Seoul before resettling in the countryside with his family back in January of this year. Following the outbreak of COVID-19, Mr. Park decided to become a farmer here in this village where his parents were born.
신랑은 한 10년, 저는 한 15년 직장 생활을 했는데요. 요즘 100세 시대라고 하잖아요. 그래서 이 직장 생활을 저희가 100세까지 할 수 있을까, 우리 나중에 늙어서는 어떻게 살아갈까에 대한 좀 걱정과 불안이 있었거든요.
출퇴근길 많은 사람 인파 속에서 코로나의 감염의 우려에 대해서 많이 고통받고 있다고 알고 있어요. 근데 여기는 그냥 저희 가족과 우리 밭 요거 두 가지만 보고 개인적으로 움직이다 보니까 아무래도 그런 걱정이 덜하다는 게 농촌의 큰 장점이라고 볼 수 있죠.
Mr. Park, being a new farmer, often turned to other more experienced farmers in the neighborhood for help and advice in raising his crops. In fact, other young farmers in the area who moved here from the city, like Mr. Park and his wife, have founded a cooperative to help each other thrive.
청년 공동체 활동인데 저희가 사실 귀농귀촌하면 청년들이 힘들잖아요. 그냥 무작정 했었어요. 저희끼리 같이 농사 짓고 여기저기 듣고 또 새로운 친구들 오면 같이 밥 먹으면서 어떻게 도와주고 어떻게 뭐 누구 만나봐라 이런 식으로. 저희가 활동한 지 얼마 되지도 않았는데 방문하셔가지고 여쭤보시고 당장에 앞에 저 친구뿐 아니라 내년에는 이제 은하면에도 또 젊은 부부가 오신다고 하신 걸로 봐선 늘었다고 보는 게 맞지 않을까 싶네요.
Amid the COVID-19 pandemic, there's been a growing interest among city dwellers to take up farming and live a quieter life in the countryside. In 2020, Korea saw a record number of households that had relocated to the countryside to begin a new life as farmers. Fears over the possibility of contracting COVID-19 was one of the main drivers that drove this exodus of urbanites to the countryside.
코로나19 팬데믹과 수도권과 광역시의 주택 가격의 급상승 등이 농촌으로의 이주를 좀 늘린 것으로 파악이 됩니다. 저희 한국농촌경제연구원에서 2020년에 조사를 한 결과가 있는데요. 코로나19로 인해서 귀농귀촌 의향이 증가했다는 비율이 20.3%에 달할 정도로 영향이 굉장히 컸던 것으로 파악이 됩니다.
Mr. Park and his wife keep a video blog of their daily lives on YouTube to share their experiences of what it's like to be a young upstart farmer.
우리 농민들은 정말 바르고 정직하게 농사를 짓고 있거든요. 그래서 직접 수확한 작물로 어떤 음식을 만들 수 있는지에 대한 홍보 목적으로 유튜브를 만들었고요. 초보 농부로서 제가 배우고 경험한 바들, 그리고 처음 하는 일에 대해서 실수하는 것들에 대해서 영상으로 남기고 싶은 마음도 있었습니다.
The farmers who've already resettled here say those who are looking to follow in their footsteps must first have a solid plan before moving to the countryside.
요즘 프로그램 많이 있어요. 그냥 뭐 홍성에서 한 달 살기, 뭐 제주에서 한 달 살기처럼 실제 지역에서 살아보고 사람들을 만나보고 농업도 좋지만 거기서 자기가 할 수 있는 찾아보는 탐색전을 여러 지역을 거쳐본 다음에 자기 지역에 맞는 곳을 가서 조금 생활을 해본 다음에 정착을 하는 게 어떨까 싶습니다.
절대로 젊은 패기와 투지만 가지고 혼자서 할 수 있는 일이 절대로 아닙니다. 정말로 철저하게 준비하셔서 행복한 귀농 생활 하셨으면 좋겠습니다.
Even now, more young Koreans are opting to escape from the daily grind of urban life to start their lives anew in the peace and calm of rural areas.
Right, up next we bring you the regular afternoon briefing on the pandemic situation here in Korea for this Monday. Now, as mentioned earlier, social restrictions under levels 4 and 3 have been extended nationwide, starting today until the 3rd of October. The briefing is about to start. We'll come back to you afterwards.
접종 기획 반장이 진행하도록 하겠습니다. 먼저 김기남 반장의
First of all, here
설명을
is Mr.
듣겠습니다.
Kim Gi-nam with today's briefing.
예, 9월 6일 코로나19
Let us now begin our regular briefing for September 6th.
먼저 예방접종
First of all, on the COVID-19 vaccination front, as of today midnight, we have over 30 million people receiving their first dose of the COVID-19 vaccine. This is about 58.4% of the total population and about 67.9% of the adults aged over the age of 18. And among them, we have 17.75 million people being fully vaccinated. And by age group, as for the first dose, we have about 96% vaccination for those aged over the age of 60, and also about 82.6% for those in their 80s. And we also have these second dose being rolled out to seniors, and we also have over 80% of the senior citizens above the age of 60 getting their second shot. And as for those aged between 18 and 49, we have many people who have received their COVID-19 vaccine, and we believe that about 83% of this age bracket will get the COVID-19 vaccination, and we have about 73% of this age bracket booking for their COVID-19 vaccination appointments. And also for the age group from 55 to 59, we also have updates on the second dose vaccination, and they already received the Pfizer or Moderna vaccines. And starting from today, we have the second dose rollout until the 19th of October, and we also will be giving out these COVID-19 vaccines going forward as well. And starting from today, we also have many people who are subject for their second dose. So if you have your second shot in schedule, please go to your designated hospital for your second shot. And as for the COVID-19 supply, we have a total of 2.55 million doses of the COVID-19 vaccines by Moderna arriving in Incheon Airport today. And also starting from September 1st until today, we have more than 8 million doses of the COVID-19 vaccine arriving from Moderna or the Pfizer. We have over 50 million doses of the COVID-19 vaccines being arrived here in the country in cumulative numbers. And also, as for the adverse responses, we have more than 48 million people receiving their COVID-19 shots so far, and we have about 192,559 people reporting the post-inoculation adverse responses. And as for the major majority of these cases, about 95.7% of them were mild and common symptoms. And also after being inoculated, we ask you to stay at the designated hospitals and vaccination centers for the next 15 to 30 minutes, and also monitor your conditions thoroughly after 3 hours or even 3 days since the inoculation. And if you have any adverse responses, please visit a doctor as soon as possible. And after receiving Pfizer or Moderna vaccine, if you have any clinical symptoms of heart inflammation, please visit a doctor as soon as possible. Moreover, as for AstraZeneca vaccine and Janssen, rarely we have the occurrence of the blood clots. So if you have any such symptoms for such kind of syndromes, please do visit a doctor as well. And as for the COVID-19 outbreak, during the past week, we have average daily domestic infections standing at 1,671, which is about 1.8% on-week decline. And despite the toughened measures of social distancing measures in the capital area, the daily average cases stood at 1,156, which is about 3.9% on-week increase. And on the other hand, in the non-metropolitan area, we saw a 12.6% decline, standing at about 515, and the reproductive index of the virus stands at about 0.98. And also, we have declined by about 5% as for the imported cases. And we have 18 new cluster infections stemming from workplaces, and also family gatherings, about 4 cluster infections stemming from these meetings. And in the capital area, we continue to see infections increase. We have been seeing toughened quarantine measures. However, we are also at seeing an increase of the risks of COVID-19 infection spread as we have more schools returning back to school. And lately, we have seen a slight decline in the number of movement in the capital area. However, we have seen a slight increase in that as well after the summer holidays. And also, we believe that these could also increase going forward with the Chuseok holiday coming. And if you have any clinical symptoms, please get tested as soon as possible. And during the past week, we have about 12% of our total inoculation stemming from foreign residents here in South Korea. And centering around foreign communities, we are carrying out tailored and bolstered quarantine measures, and we are also carrying out COVID-19 vaccination for these group of people. And cooperating with other central government ministries, we are also providing the inoculation support measures as well. And we ask you to also get your COVID-19 shots if you are living here in South Korea. And today we have also the attendance cap being eased to about up to 6 people in the regions at level 4 and up to 8 people as for private gatherings under regions that are under level 3. And to this end, we believe that there could be an increase in the number of gatherings and meetings, which could hike the also the infection risks. And it is very important that you comply with the quarantine measures going forward. And lately, we also saw many people also being infected at the PC rooms and coin singing rooms, and they were students as well. And also lately, we are seeing more schools opening up for in-person classes. And to this end, it is very important that all of the students and faculty members to bolster their quarantine measures at schools as well. And lately, at the large also hospitals, we have seen cluster infections, and we have seen that there have been insufficient ventilation there. And to this end, we are also bolstering our inspection preemptively at such clinics and health facilities. And to this end, we are also going to provide guidelines for the ventilation systems, and also cooperating with the hospital, we will carry out on-site inspection. And we also had some administrative errors of COVID-19 vaccine, mostly were those vaccinations with the vaccine doses that have seen the surpassing of the expiration date. So we ask the doctors and the healthcare officials to also take particular notice. And as for mRNA vaccines, you should also double check the expiration date that is labeled on the box as well. And as for the preventive measures of such administrative errors, we will be having a special labels on the COVID-19 vaccine boxes so that they could be delivered to the hospitals on a timely basis. And we need to also train and educate these medical workers going forward. And together with the local governments and also the healthcare community, we will make sure that we contain such the repetition of such administrative errors going forward. And here's some updates on the free influenza vaccines here in South Korea. And these people subject to these free influenza vaccine will be about 14.6 million people, including toddlers between the ages of 6 months and 13 years of age, and seniors and pregnant women. And starting from this month, we will be rolling out the vaccine for senior citizens and also toddlers and children who are subject to shots. And also starting from October, we will also provide the vaccine to those people, children who are subject to only one shot. And also, we are going to provide the vaccines to the seniors starting from October as well. And they have different dates for the age group. So we believe that these free influenza vaccine is very important. They will be given out at local community centers as well as designated hospitals. And also, as for hospitals, we have about 20,000 hospitals that are rolling out these these vaccines, you can also check these information online or through application. And this year, very particularly, we have the COVID-19 vaccine also rollout at the same time. And in order to disperse the people, the recipients of these vaccines, we ask you to also book your influenza vaccines in advance. And as for these vaccination reservations, we will also provide more updates at the end of this month. And in order to secure the safety of these vaccinations, we ask you to check the designated hospitals and also make sure you bring your ID card. And also, if you are pregnant, please also bring your certificate as well if you go to receive the influenza vaccine. And we have about 20 million doses of the influenza vaccines to be rolled out and to be procured this year. And as for the doses for the seniors, we will be providing these will be provided by the local governments. And as for the rest of the doses, we will also be providing them directly to the hospitals. And also, in order to prevent any errors in transportation and in terms of logistics, we will make sure that they are traveled and delivered through the cold chain system. And we will also make sure that we have advanced checking, that we do not have any loopholes in our logistics and delivery. And as for the procurement agencies, we are also having inspections on site and to also make sure that these vaccine doses are delivered safe and sound. And also to respond to emergencies and also as for contingency measures for lack of influenza vaccines, we will make sure that they are distributed to the areas that are in need, and we will have a flexible operation of these influenza vaccines as well. And at the same time, we are also providing the influenza vaccines on top of the COVID-19 vaccines, and so we ask you to comply with these specific guidelines going forward. And starting from today, we have the month-long extension of the social distancing measures. We have the same measures to be in place. However, we also have cautiously eased our virus restrictions to a certain extent. And we will also monitor the continuous outbreak of the COVID-19, and also we will be bracing up for the run-up to the Chuseok holiday, and we ask you to also comply with the quarantine measures, including washing your hands and face masks, and also take particular precautions when you have gatherings and meetings. We will also make sure that we exert our full efforts to this end. Thank you very much.
지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다.
Right, that was Kim Ki-nam with Monday's afternoon briefing, and I have Soa back at the desk with a summary of his address. Soa.
Yes, Sunny. Let's start with the weekly trend in COVID-19 infections here in Korea. 1,671 is the average of daily infections in the past week, which is a decline by 1.8%. However, we're seeing a rise by 3.9% in the capital region, but a decline in non-capital regions by 12.6% on a week. But the official mentioned that there is always the chance of more cases spreading to outside the capital region once the Chuseok holidays start. Now on to vaccination updates. Second shots are being administered beginning this Monday for those aged 55 to 59. And on vaccine supply, the official said some 2.5 million Moderna doses have arrived here in the country this Monday. And something that may has not been on our minds lately is flu shots. So the official mentioned that free influenza shots will be administered beginning on September 14th. So it will be the first time that we're having simultaneously flu shots and COVID-19 shots being administered here in the country.
All right, so thank you very much for that information.
Anytime.
유행 규모가 크고 감소세가 없이 정체하고 있어 전면적인 방역 완화는 어려운 상황입니다.
היום אנחנו מרחיבים את האפשרות לקבלת חיסון דחף, חיסון השלישי, לכלל האוכלוסייה.
Social restrictions have been extended for a month starting on this Monday nationwide, but regulations have been slightly eased for those fully vaccinated. For more, I have Professor Chung Gi-seok from Hallym University. Welcome back, Professor Chung.
My pleasure to be here again.
I also have Professor Kim Min-gyu from Yonsei University. Good to see you again, Professor Kim.
Thank you for having me.
Meanwhile, to share with us a glimpse of Israel's efforts to learn to live with COVID-19, I have Professor Cyril Cohen at Arirang University. Pleasure to have you with us, Professor Cohen.
Likewise, Sunny. Good to be with you.
Right. Professor Chung, we'll start here in the studio. Let's begin with your thoughts on the month-long extension in social restrictions here in the country.
Well, I think it's appropriate because we are quite accustomed to a 2 weeks interval, and the government kept saying that 2 weeks is very important, maybe very critical for a long time. But finally, the government seems to be admit that in a month's time, they cannot do anything without boosting vaccination. So that means for a month's time, the government is going to maintain this kind of suppression. We know that the social distance level in foreign capital area doesn't work very well, but at least it can prevent a sudden surge or a cluster infection, so it works. And by that time, in a month's time, maybe fully vaccinated people in Korea will be over 50%. And that could may lead to decreased daily tally or daily critically cared patients and the fertility rate. So maybe in a month's time, we are expecting another social distancing level eased. So I'm really expecting that.
Right, and speaking about ease, Professor Kim, the extension comes with a slight ease in measures regulating business hours at restaurants and cafes, as well as caps on social gatherings. Now, keeping in mind our 4-digit tallies, what are your thoughts on these measures?
I think it's a good news that the confirmed case is not increasing, rather decreasing a little bit. And the level of social distancing should be based on scientific facts. And the speed of vaccination, along with the quarantine measures we take, might be the key factors determining the decisions. Here are some facts that we have to remind. Delta variant can transmit asymptomatically 2 days before onset of symptom, and this phenomenon can happen in even 75% of Delta infections. And we know that Delta variant is about 2 times more infections than the original strain. So the conclusion is the more we have vaccinated, the more we can ease social distancing right now. And one thing of concern is that the portion of cases we cannot find the route of transmission is increasing. Now it's up to about 37% right now. Maybe we are on the way to live with corona, and maybe we are missing something important. Maybe epidemiologists have to figure it out. And some degree of easing social distancing is necessary, but everybody should be vigilant.
Right, they should. Meanwhile, Professor Cohen, Israel last week recorded worrying tallies in the 5 digits. Do tell us a bit about the situation in Israel.
Yes. So basically what we have seen is that since the end of June, we have seen a rise in cases because during June we were almost at 0 cases virtually. And what happened basically is that the Delta variant arrived. It started in 2 schools and then it started to spread. During July, we saw a real increase, mainly in cases, not in severe cases in hospital, but then, 2-3 weeks after that, of course, there were severe cases. I think that the point was that what the government, and I can tell you because I had, some meetings with officials, what the government decided was to focus only on severe cases on the one hand, and second hand, just, do some booster shot that we started at the end of July. And basically with all that, what we are seeing right now is true, we have a high level of infection, daily infections, but on the other hand, the number of severe cases is stable, even going down. The R naught, the basic reproduction number of the virus, is around almost 1 soon. And we're trying to live with COVID-19. That's the point.
Right. Professor Kim, comes mid-September, Koreans celebrate the Chuseok holiday, and authorities have further eased restrictions on family gatherings within homes and visits to nursing homes during this particular period. What are your thoughts, especially for those who are fully vaccinated?
For healthy people, COVID-19 might end up with mild symptom or even asymptomatic, but the elderly patients who in a nursing care centers, they might end up with devastating results. So if you are exposed to COVID-19, if somebody close to you is exposed, and if you have any symptom and signs like infection, please change your plan for Chuseok. I mean, when you are thinking about meeting many members of your family, you better change. And try to modify the way of family gatherings, like you prepare outdoor meetings and open the windows and ventilate every time. And usually in Chuseok we have a big meal with many people's heavy drinking, but you may shift to a light one without any alcohol. And that is my recommendation. Before you meet somebody, check whether he or she is properly vaccinated, and don't think that vaccine is a perfect plan. Minimize direct contact with elders and as much as you can, and yeah, you have to wear a mask and hand hygiene, and try not to share meals as far as you can. So vaccine completion rate of Korea is far lower than satisfactory for Chuseok, so that is why you have to keep these precautions.
Right, we have to remain vigilant. And staying with holidays, Professor Cohen, I believe Israel is poised to celebrate the Jewish New Year, Rosh Hashanah, at sunset on this Monday through sunset on Wednesday. What measures, Professor Cohen, are in place to ensure a safe celebration this year?
Actually, we do not have many measures. You know, we actually asked to limit gatherings, for example, in synagogues, to no more than 50 people that are vaccinated with what we call the green pass. We do not know to what extent it will be enforced, but there are, I would say, clues that it will be enforced. Other than that, we are just asking people to limit family gatherings. We are also asking that if you are to meet with people that are vulnerable, you should do a quick test before that so that you can know more or less your status. And again, you know, try to do that, as you just said, outside. Try to limit, you know, the number of people you will receive at home. And hopefully, we won't see much of a rise in cases.
Right, hopefully. Professor Chung, amid the extension in social restrictions here in the country, some critics are casting doubt on this strategy of containment in tackling the pandemic. What are your thoughts?
Well, I see quite many people, even the scientists, are complaining of the social distancing is not working anymore. In part, it is true, but I think that the social distancing, the toughest one in capital area, is working, has been working, even though it cannot decrease the occurrence of daily tally, but it can at least sustain this kind of occurrence so far. But if you think about another study which is announced in days ago, the scientists told us that the third wave and the fourth wave in this country, after the social distancing, they didn't find any decrease of movement, reason-to-reason movement, or total traffic volume was not decreased. That is mainly because of people are quite accustomed to a constant level of social distancing. It's almost 9 weeks since we have toughest level 4 in capital area, and people are getting less alert, and people lose attention, and some people are sick of abiding by social distancing rules. But anyway, I think the social distancing is very necessary for the time being until we have fully vaccinated people more than this level. Again, I have to emphasize the social distancing and mask mandate is very, very important. Until we have another kind of a bullet, like I said before, it's an oral medication for COVID-19 disease. So I think the social distancing is working, but sometimes we need more additional measure to overcome if we have another surge or another cluster infection for days to come.
Right, and hopefully we won't.
Yeah.
Professor Kim, also on the local front, starting today, under level 3, the academic arena is fully open, and under level 4, 2/3 of the student body is allowed at school. What are your thoughts on this measure?
The desperately needed thing for us to fight against COVID-19 is a drug specific for COVID-19. And as Professor Jang mentioned, it's not going to be here with us for a few more months. So if we cannot have a drug, the vaccine is the only choice right now. But the more younger the student is, the benefits of vaccination becomes less. You have to worry about the harms that might happen among young children. There are more than 20 countries already vaccinating students from 12 to 18. And some countries are a little bit conservative, allowing vaccine only for students who have risk factors, like Germany and UK. My opinion is students in elementary school or younger, they can attend the school and delay the vaccination. But students more than 12 with risk factors, I think they should be vaccinated because many reports say their vaccines give more beneficial effects for those groups.
Right. Professor Cohen, the academic year began last Wednesday, I believe, in Israel, with some 2.5 million students returning to school. What efforts are being made to contain outbreaks within the academic arena in Israel?
Yeah, so we have several protocols. We have implemented several protocols. First thing, every kid was supposed to be tested the day before school started. And if he were to find positive, she were to found to be positive, he would stay at home and and do a PCR test. So this was done with quick tests. Second thing, we are now, because we think that education is a priority, although now it's the time of the holidays, so we do not have a lot of school days. But starting October 1st, if, for example, we find one case in a classroom, what we're going to do, instead of sending the whole classroom at home, we are going to have a daily testing of the kids in the classroom so that they can continue to go to school. And in what we call red cities, in which there are a lot of kids that are not kids, but people that are with COVID-19, what we do is that you can go to school if you are for 12 and above, if you are vaccinated. If 70% of the classroom is vaccinated, you can go to school. If not, we'll do that using Zoom or whatever virtual platform.
I see. Professor Cohen, by red cities, you mean cities that have large infection outbreaks?
Yes, exactly.
Professor Kim, I believe you have a question for Professor Cohen.
Yes, nice to see you again. Professor Cohen, yes. Israel approved vaccines and even the booster shots for children of 12. And compared to the adult counterpart, what kind of serious or unusual side effects do you see in Israel?
So it's a bit too early again to say, because we just adopted that a week ago, and we still have, I would say, a lot of children, or I would say adolescents, that didn't go through the first and second vaccination. What we hear so far is perhaps a little bit more, I would say, fever and sore arms. We haven't seen any major complications. Again, it's a bit early, but we are following that with a close eye. And I guess that in a month, we'll have more data about that.
So, Professor Cohen, you're basically saying there have been no cases of myocarditis among the children?
right now we haven't seen. And I would say the interesting thing is that the myocarditis that we have seen so far was mainly for age of 16 to 25. For age of 12 to 15, we have seen a much lower, I would say, level or frequency of myocarditis.
I see. Professor Chung, I believe there is a question that you would also like to ask Professor Cohen.
Yes. Hi, Dr. Cohen. I'd like to thank you in advance that you are sharing your experience with us in Korea. My question is about the booster injection. I think it's a bit early time to estimate your booster effect, but I'd like to know if you see any effect with the booster shot in terms of lowering critical or early ill patient, or lowering case fatality, or lowering breakthrough infections.
Yes, this is an excellent question, and actually we do have some data because we started with booster shots during July, and we have gathered data from several sources, different HMOs, and also the Ministry of Health, and myself, I'm working on a report. So what we have seen right now is that the booster shot really helped because we have seen a decline of immunity for people that got 2 doses, especially if it was early on in January and February. And what we have seen is that it can not protect from infection as it was originally against the Alpha variant. And then we decided to go for that booster shot. So right now, just to give you a number, if you are above the age of 60, if you have 2 doses, you are protected 3-4 times more than someone not vaccinated if you are to go into severe condition. But if you got your booster shot, you are protected almost around 30 times more. We have seen that the booster shot can bring you back to a level against the Delta variant, to a level of protection against infection around 95%, 15-16 days after the booster shot, 97% from severe cases. So we really see that the booster shot can help. We can see that it can bring, even push your antibodies very high, higher than what it was after the second dose. So we believe that this is a good strategy.
Right, that is quite comforting to know, Professor Cohen. Professor Kim, back here in the country, there have been unfortunate cases of inoculations using vaccines that had been stored improperly, now, and then rendering them, of course, ineffective. What are your words of advice to those who may have gotten these shots?
Every drug has expiry date, and usually the injection drugs, they have a condition to how to store and how to use it. The news that we face is something worrying, but we have to remember that RNA virus is very fragile. It's for the temperature. I think it's not a problem with severe side effects. We have to worry about the effectiveness of vaccine is going to be weaker than the normal shots. So I think hospitals have to monitor the patients who got the shots wrong and check whether their antibody titers or something, they might be more vulnerable to COVID-19. I think that's the way we should go, and it should be prevented. Something should not happen.
Right, it shouldn't. Professor Chung, there have been 3 cases of the Mu variant here on the local front. Very briefly speaking, what has been shared about this variant of interest as designated by the global health body?
Well, we don't know, and even the WHO doesn't know what Mu is acting now. How contagious it is, how virulent it is, they don't know. But we in Korea, we have 3 imported cases from June, May, and July from 3 different countries: Mexico, United States, and Colombia. And Colombia is very notorious for Mu variant. So we have to learn lesson from Delta virus. We had Alpha, Beta, Gamma, Delta in Korea, but Alpha, Beta, Gamma was not a big deal. But Delta is now nearly 100% predominant variant in Korea. So if we don't know exactly the Mu, but if Mu is going to be a very predominant variant in Korea and it is a very virulent one, then we have to prepare in advance. So we have to pay really attention on 3 cases and make a thorough epidemiological investigation and make extensive laboratory work on that. And if needed, we need in advance vaccination or in advance isolation and quarantining process in the airports and other ports. So we should learn from a Delta virus lesson, and we should be very prepared for the new variant.
Right, we should take a proactive stance on that then. All right, Professor Chung, thank you very much for your words today. Professor Kim, thank you for being with us with your thoughts.
Thank you so
and
much.
Professor Cohen over in Israel, thank you very much for your time and your thoughts. And Shana Tova, Professor Cohen. Right. Social restrictions stand at level 4 here in the metropolitan region and level 3 elsewhere nationwide starting today, that is Monday, for a month until the 3rd of October. So do seek to abide by these guidelines. In the meantime, thank you for watching. See you on Tuesday.